Hi, I'm Doug Johnston. I'm the Chief of Cardiac Surgery here at Northwestern Medicine and Surgical Director of the Bloom Cardiovascular Institute. Radiation-associated cardiac disease is considered an orphan disease because often patients who've been treated for Hodgkin's or other thoracic cancers have successful treatment of their cancer, which is truly a medical miracle, but they are often not told to follow up for cardiac sequelae. The danger is that they're treated like any other patient who's not had radiation because the way the disease behaves is very different. So at Bloom Cardiovascular Institute, we recognize that multidisciplinary care is at the core of radiation heart disease care. On one end of the spectrum are patients with an isolated lesion, a single coronary lesion, and in particular aortic valve disease, where even in young patients, a structural intervention is probably the best option. We believe that TAVR as the first intervention is the right thing to do for most patients with aortic stenosis, knowing that down the road, most of them will develop multi-valve disease and that surgical treatment is very complex in these patients. We have a lot of expertise in doing first-time and reoperative cardiac surgery, but we recognize that it is riskier in radiation patients than in non-radiation patients, and those selections have to be made carefully. So we offer expertise in EP, in structural heart, in coronary interventions, and in complex surgery for radiation heart disease, including the commando operation, which we have extensive experience in, allowing for replacement of 2 valves in patients who might not otherwise be candidates. These patients are very different from the average coronary or valve patient. Their outcomes are different, they behave differently with intervention. The long-term prognosis is often difficult to determine at the time of presentation, and they really benefit from expertise. We have a team of experts, including me, who has spent years studying this problem. We've written about it. We are very used to helping people who don't have local expertise. We talk with cardiologists around the country and around the world about this problem, and so we are prepared to help you literally no matter where you are to get the right care for your problem.